I'm so looking forward to our next presenters because they are going to speak and address what questions that we need to ask to get the best healthcare. And that is it's in all of our best interest. And so we're very glad to have both Helen Currier and Glenda Harbert here with us today. And I see Glenda's face already. Hi, Glenda. Good to see you.
Great to see everybody.
Yeah, Glenda is director of the ESRD network here in Texas. Glenda, I live here in Texas, and luckily I've never had to interact with you. I've always had great things for me here in Texas for my renal care. So thank you for your part in that. And Glenda is also a certified in nephrology nursing and healthcare quality, correct?
Yes, that's right.
Okay, very well. So you are certainly qualified to take care of today's presentation, right? Along with Helen Currier, your accomplice, right? Helen is a preeminent nurse figure and has over 40 years within the renal nephrology world, and she certainly has the experience to go along with that as well. And so both of you ladies, thank you for coming and addressing what questions we have on what we should be asking. Please take it away.
All right, I'm going to share my screen. So, hi everyone. Thank you so much for inviting us. We're very delighted to be here and share some information with you that we hope will be very helpful. So, oh no, I can't get my slides to advance. There we go. So you might be saying, why am I putting what is health literacy up here when we've been asked to talk about what questions you should ask? The reason for that is that literacy and health literacy in particular is more about just listening and reading. It's being able to understand what's being told to you. And so you obtain the information, you process it, means you can understand what's been saying so that you know about the basic health information and services you need to make appropriate health decisions for yourself. And that's really what we're here for as a team. But you're the main member of the team. And so you need to be able to understand and act on the information that we as professionals are trying to give you so that you can make the decisions you need to be as healthy as you can. So here's a little thing. The Institute of Medicine is a big government agency that does lots of research and education, and they've looked at this issue of adults with limited literacy. And here's some really important information that they found out. If you have limited literacy, you have less knowledge of your disease management and health promoting behaviors. So what does that mean? It means you can't really know what you need to do to manage your own health and to engage in healthy behaviors like that exercise program that we just had. Wow, I was doing that and I'm like, oh, I need to do some more of this stretching and flexibility, huh? So it's not just all about your renal diet and your renal meds, it's about the whole you and understanding how to do things that are going to make you healthier and as healthy as you can be. Also, people with limited literacy report poor health status, and that means that they don't feel as healthy. Maybe they're not really as healthy, and they're less likely to use preventative services. So, if we go into preventative services, then we can perhaps prevent complications and problems. And finally, here's a big one. Who wants to have more hospitalization and emergency service use? No one, right? So with limited literacy, people have higher hospitalization rates and emergency service use. And get this, 90 million U.S. adults have literacy skills below the high school level. You may be thinking, oh, I'm literate. I know, I read, I study, I can speak, but it's really about more than that. And really, it doesn't matter whether somebody has a high school education or people with high college degrees. have poor health or limited health literacy also. And there are over 300 studies showing that health-related materials far exceed the reading average ability of most United States adults. That's all of us together. And I know that you've had this happen to you. I've had it happen to me too, even though I'm a nurse. You get some information handed to you about some treatment that you're going to get or some about your disease, and you start reading it, and it's like you can't really understand any of it. So let's talk a little bit more about that. Here you can see this graph showing the levels of the percent of Americans and their health literacy. And you can see that 14% are below basic, 12 are what's called proficient, or they can get by, intermediate, and then basic. But study, this really impressed me, that examined patients' ability to understand 5 instructions on a prescription medication. Both patients with adequate and low literacy had trouble understanding at least one of the 5 instructions. So I was sick recently, and I went to the ENT, and he gave me a couple of prescriptions, and I picked them up from the pharmacy, and I came home, and I looked at this bottle. It was steroids, and it said, take 3 pills a day. So I said, does he want me to take 1 pill 3 times a day, or 3 pills once a day? Whatever. What did I do? I picked up and called the pharmacist. And the pharmacist said, well, that's the way the doctor wrote the prescription, and it isn't very clear, is it? But the pharmacist assured me that it would be okay to take the pills all at once, just 1 time a day. And so that's just a small example of the things that happen. And some of these pills that, and many, many pills that people with renal failure are taking are very complicated. And so just know that if you get a prescription, you look at it, you are unclear about what it says, how to take it, be sure and talk to your pharmacist or go back to your dialysis team and physician. So here's some more facts about this. 1 in 5 American adults read at the 5th grade level or below, and the average American reads at the 8th to 9th grade level. Now, we've already said that most of these health materials that we give out are way above that. And so people get them, they look at them, but they really can understand what it says. And furthermore, minorities and immigrants have more literacy problems. 50% of Hispanics, 40% of Blacks, and 33% of Asians. So just know that if you fit any of these categories, and also 66% of adults over age 60 or over have either too little or marginal literacy skills. So just know that if you're in any one of these categories, or you're just an average American, that you may have limited health literacy. So let's talk, and the materials are written at 10th grade level or above. We're probably lucky if they're only at the 10th grade level. So why does this matter? Doing what you need to do for your health requires understanding. And whether that be how to take your medications, or what you're asked to do in terms of your treatments or your diet, or any other thing about how you manage your health, you have to be able to understand what's being asked of you. And so here's a good example. Illiterate right for free help. So I'm going to go ahead and laugh because I can't hear you laugh. Now, what did the doctor say? What the doctor says, medical jargon, talking fast, and then says, do you have any question? What the person hears is probably, are you speaking my language? Blah, blah, blah. And so what did he say? So let's talk a little bit about some questions you can ask when this happens to you, which is all too frequent. I'm going to talk about plain language. This is something that's been introduced to health professionals that is about communication that somebody can understand the very first time they read or hear it, the first time. And the concept of using it is very closely related to actually being able to have health literacy. Clear communication, as you know, is critical to your health. So when a doctor tells you something you don't understand, ask, "Can you tell me that in plain language, please?" Don't be afraid to say it. You know, they're standing up there talking with all this medical jargon terms that you have no idea what they mean. And they're talking fast and they're in a hurry. Say, "Can you tell me that in plain language, please?" When any health professional gives you a lot of information or when you don't understand fully, ask these three main questions. It's pretty simple. I say, put this on a little card and carry it in your purse or your pocket whenever you're going to your treatment or to a doctor's appointment or any health professional appointment. What is my main problem? What do I need to do about it? And why is it important for me to do this? And if you can understand the answer to these three questions, then you can be fully engaged in helping to do the best thing that you can to manage your health. And I'm going to turn it over to Helen now. Helen?
Yes, thank you, Glenda. So where do I start? And we're going to go through 5 questions that you can ask yourself. And the first one being, what is my goal? Second, what do I want to get out of the conversation? The third, do I want validation? Sometimes we need validation. We need to know that we are on the right track or doing what we need to be doing for our health. Next slide, please. Glenda?
I am trying.
And then more questions. The fourth one, just someone to hear me out. Sometimes we need to vent, and that's perfectly good. And that is one option. And then the fifth, or am I learning, or am I looking to learn more about an issue? So here's the 5 questions. And the 5-question prep helps you determine who you should have a conversation with, and whether the person you're thinking of talking to is actually a good fit. So, you know, who is that person? Me. And so who might your options be? It could be a medical assistant in a clinic, or at a patient care technician or aide in a hospital, or a dialysis technician in a dialysis unit. Could be a nephrology nurse, or those are kidney nurses. It could be a renal dietitian, a social worker, a nurse practitioner, or physician assistant, or nephrologist, or it could be your nephrologist. Next slide, please. Always seek clarification, as Glenda said, in plain language. And then if you're feeling overwhelmed, you can say, hey, this is a lot. Can we take a minute? So let's practice. So here's the first question. Find out why I just started having constipation. Number 2, is this because of a new medicine that was started? Number 3, I don't need validation. Number 4, I don't need someone to hear me out beyond listening to my concern. And yes, I'm looking to learn more about the issue. So here of the options, who would we speak with? A nurse practitioner or physician assistant, nephrologist, or you're a nephrologist. Sometimes physicians are rounding and you're on dialysis, but they aren't the physician that is your primary nephrologist. So it makes a difference who you take your questions to. So here's the question, doctor. I want to know why I started having constipation. I just started taking this new medication last week. Is it the new medication? Will it go away on its own, or should I stop the new medication? What else can be done? And blank have usually helped me with constipation in the past. Don't be afraid to tell the physician or your healthcare workers what works for you. Okay, here's another one. I want to know more about qualifying for a transplant. I need a step-by-step list of what I need to know and do to get on the transplant list. Now, notice I was very specific. I need a step-by-step list because often we get that information and it isn't clear. Number 3, I might need validation. Number 4, I need someone to hear me out since I've asked before. And yes, I'm looking to learn more about the issue. So here, so let's practice. Is there someone who would like to give an example of a question that they had, but once again, using this model? Okay, so
Helen,
yes.
I have one I might put out there.
Okay, and we have one in the chat.
Oh, go ahead.
So it's what if I feel like I'm annoyed if the staff, when I call in like the front desk to leave a doctor message? Well, then you often whenever you have been admitted to a clinic or a care, you end up getting lots of paperwork. And oftentimes that paperwork tells you that you've signed about how to escalate. And and you can always connect with the manager of that area. And then the other comment is, what if, like in my experience, they minimize my question and concern, like, don't worry about that yet. So that is frustrating. And I think it is not surprising that that the healthcare provider is trying to prioritize what you're focused on. But I think you just repeat it. And the number 4, do you need someone to hear you out? And that might be a way to address. Okay, and then Glenda has one, and then Glenda, can you? I have another one. Okay. Move on to the next slide.
All right, sure.
Okay, so in the mail today, you get all of these things about MA plans, and if you look really closely, it has the word healthy is bolded, healthy grocery allowance. It is $800 and some a year. And then there's one for a voucher for the Cheesecake Factory, and all of these inducements to join different MA plans. Does anybody know why they wanting to join their MA plans? Well, they're in competition with one another. So they, this is all their way of making income, bringing in monies. And MA plans in general, they're rewarded for the money they save. So what questions would you want to talk to your healthcare provider or your physician? Take these in and say, if I change to this MA plan, can you tell me, would this change the care you're able to provide for me? Because sometimes it does. That's, an example. I think I know of a a patient and their family that took the healthy grocery allowance, and then it changed their eligibility for other Medicare allotments or Medicaid allotments. So you have to be really careful. So it's another good question to ask. Go ahead, Glenda. I guess we can put it back on the other slide.
Okay. Excuse me. So mine is a question. Can we talk about how I am really doing? I feel like I'm going downhill and I'm getting really tired of all this. So I feel like the goal in this is to have an honest conversation with the doctor about how things are going with your treatments and how your healthcare is going and maybe what's ahead for you. What do you want to get out of this? Well, you want to understand really what your situation is. And you want to figure out, is there something that can be changed to make that better? Is this something that you can do in your own life, in your own disease management? Is there something that the professionals can do in their management? Is there something that you need to know about how your disease is progressing? Do you need validation? In this case, I think, yeah, you do. You need validation that you need somebody to hear you out in saying, I feel like I'm not doing well. I feel like I'm going downhill. And, the whole thing is just wearing me out. I'm tired of coming to dialysis. I'm tired of feeling bad all the time. And so, yes, you're learning to learn more about the issue and what could be done about it and what the options are moving forward.
Can you all share some of your experiences over time? Do you feel as though you've been able to ask questions, clarifying questions in a more effective way?
I have a comment to make. My comment is that what do you suggest? Like, I've gone into lab appointments or office visits, my monthly visits, and I'm told one thing by one nurse practitioner and then another thing by the other one. And then they kind of come to the conclusion that maybe I didn't hear the instructions correctly, but I hear two different things. So I don't know which one what do I say? Do I need them both together to tell me what it is, the instructions that they're giving?
I think that you can ask a clarifying question and point out that you have heard two different things. Again, because of health literacy, they may think that they've said about the same thing, that there's a nuance to it. And you could say that. Is this something that is a nuance, or is this something that I really, need to seek what it is that's best for me?
And it's okay.
Because I've been in that situation, and you hear like one person tells you one thing and another tells you something else. It's okay to say it without saying, I've heard, I've had, two different directives, and I'm trying to determine if they're truly, is this a nuance, or is there something that's changed? Was there a change, like one day or whatever the time frame is?
Okay, I'll give you the example of what it was. So I had peritonitis, and one of the medications, which was an antibiotic, it's supposed to stay in your bag for 6 hours. So I do 2 treatments in the day and then one on the cycler. So one nurse said you put the medication in the cycler, and then that's it. And then the other nurse said, no, that wouldn't work, because if you're on a cycler, each thing is only 2 hours each, so you don't get the total of 6. You need to put it in the day bag and then keep it for 6 hours. So what I said when she told me that, I said, well, I'm glad that you clarified that for me, and I'm going to write that down. Today is this day, and I'm here, and I'm talking to you, and according to you, this is what you said. So if the nurse asks me, I'm going to say, we just, that's how I kind of dealt with it.
Well, that's really great to, document it for yourself.
Mm-hmm.
And also it lets the healthcare provider know that you're really paying attention, that you understand that this is important, and you want to do the right thing for yourself.
Right.
Yeah.
The other, we do something in healthcare where seeking clarification, we ask the 5 whys. Ask,
Right.
someone said, you can say why, and then whenever they answer, then you could say why, and just ask why like 5 times. I mean, without being annoying, but to really get to what is the best thing.
Right. Thank you.
We have another thing in the webinar chat. Yes, I feel my nephrologist is waiting for me to be on dialysis downstairs. I'm 4th stage now. He doesn't talk. Well, in general, physicians don't like to deliver what we would call bad news or not favorable news. And honestly, sometimes we don't know. We don't know how long it's going to take to go from stage 4 to stage 5 to advance. And so sometimes the easiest way to address that is not to say anything at all. I know that doesn't sound very satisfying, but sometimes physicians don't know. One of the things that you can ask is say, I'd like to talk to you about preemptive transplant, and that is receiving a transplant before you were on dialysis. Now, whether or not you actually want a preemptive transplant doesn't make any difference. You can say you want to talk about it, and then you'll probably have a conversation of more depth.
And you can also say, I know that I'm at stage 4 and at stage 5, something will need to be done. What are all of my options?
That's a good point.
Are there any more questions? Really, anything that you are thinking about and you're wondering, how could I say this, or how could I manage a situation where I was frustrated and I need to communicate that to my healthcare team?
I just wanted to make a comment that sometimes it's not the nephrologist. Different personalities have different capabilities of communicating. And sometimes it's the nurse that I'll ask a question after the doctor leaves. Could you clarify this? Is this what he said? And sometimes you need to find the good resource at the clinic, the center, wherever you're being treated at.
Yeah, that's a good point.
You know what? I have a question, Helen and Glenda.
Yes.
A lot of new nurses and a lot of new healthcare professionals. And oftentimes I've run into a situation that I know they should be doing something differently, or they don't have the knowledge that they need to have. How do you bring up that discussion without feeling you're going to be retaliated against?
That is scary. I imagine that's
Yes,
very
that's
scary.
Lori, that's a really good
Mhm.
a good point. As I was a pediatric nephrology nurse, all of my career. And I think I only had to make one error. And then whenever a parent said, "Are you sure about that?" Whenever I'd come into the room, I would always go, "You know what? Let me go check."
Mhm.
Or so you could say, "Would you please check on that? Because I heard something a little bit differently."
Mhm.
But you're right. There is fear of retaliation, and it is tricky. Really good nurses, though, learn quickly
Mhm.
to listen. I mean, listening is important,
Right.
and patients always, know. I mean, about people that have kidney disease know about their bodies, and they know how they feel, and so that's important. Um, if you're have the opportunity to sit with a nurse or a new technician, you can tell them about, times where you learned about something or how nurses learned about something, sometimes that, disclosing how a journey of learning that you had might, inform them.
You could also, if you have, I mean, if you, I don't know exactly the setting, but like if you're in the dialysis unit and something like this comes up and you have a tech or another nurse or someone that you know and trust, and you feel questionable about what's happening, you could say, "Hey, could we get Joe over here and get him involved and let's talk about this?" Something like that. Without making any quote unquote accusations, but you could try to bring someone in who you trust has the knowledge that's needed in the situation.
So there's a question about, do patients that are over 70 get transplants? The comment is, "I feel like life begins at 71 years of age." Okay, that's a good comment, because of the organ shortage. Deceased donor or a donation from somebody who's passed, who's agreed to be an organ donor, those those donors there aren't enough to meet the need. So, like for instance, a hospital in the medical center here in Houston, Texas, won't put anybody on a deceased donor list that is over 60, which is really surprising to me. So in that case, you need to seek a living donor. Might be somebody that you're related to. It often is, but it can also be what we call a loving related donor, that somebody has just decided to donate a kidney. There are these altruistic individuals out there. So if you are 70 years of age, you might want to come to the physician and say, "Tell me more about receiving a living donor transplant, and how and do you have any direction on how I might have a conversation with my loved ones?"
Mhm. And Helen mentioned the loving donor, the altruistic donors, something called paired kidney exchange. There are a number of programs throughout the U.S. that have this set up, and it's an amazing thing. Normally, it may start with one altruistic donor, someone who comes forward and says, "I'd like to donate my kidney," and then it begins a process of matching people that have a loved one, a relative that's willing to donate, but they're not a match. And they do this amazing, complicated thing of matching up other donors that don't match with other recipients that need a kidney. So it's really quite amazing.
So there's a question or comment that, one transplant center transplants people even into their 90s. And so they may take different donors. There are sometimes that they're donors where the kidney might have had an insult, but for your likely longevity, that would work good for you. You can also be listed at multiple centers. And of course, that would be a challenge because each center has, they have similar yet different criteria. But those are questions, you can ask and write them down. I mean, you have to have a notebook for this. It's really, really complex to be approved for just to be a recipient.
So someone just asked in the chat, how do you get listed for a kidney at more than one center?
You have to reach out to the transplant center there or ask your nephrologist for a referral. This is something that your primary nephrologist would want to know, would be probably best suited. If you you go on the internet and see, which facilities transplant. You'll probably, most people, want it to be fairly close to their home. So you can give a list of all of those to the nephrologist and say, I'm interested in pursuing, this at all these centers, and then they can make a referral, and then you can, follow up from there.
I wanted to just chime in. It's always good to work through your nephrologist, but I've had situations where you can just call a transplant center and ask for an appointment. You don't need a referral anymore.
Yeah, I think that's great, Lori. Thank you for, because that was a change made because they're trying to promote transplantation, so there are fewer barriers.
And we have a transplant dashboard on our website where we could put the link in that gives you all the transplant centers in your area. And one thing that's really important to look at is, if a center is only doing, very small number of transplants per year, you can see the quantity, like, Cedars-Sinai does a lot more transplants than some of the other hospitals. So you can multi-list. There's different geographical regions, and it's not always convenient, but you don't need a referral to ask to multi-list. So you just call up the transplant center and make an appointment with them and see if you like them, and then they may make you do all the same tests all over again. Just be aware of that. But in California, we can list in Las Vegas, we can list in Arizona, we can list in San Diego, we can list in San Francisco, and we can list in Los Angeles, Orange County. We have a lot of options that are not too far away, but most people in this country, they're lucky if they have one or two centers in their area. So, but yeah, be your own advocate.
Well, I appreciate you saying that, Lori, because I know I had a conversation. This is Gigi. I had a conversation with Cher because I have Kaiser insurance. So I did go to my nephrologist and I said, I know I'm listed at UCSF. Can I be listed at UC Davis or Stanford? And I was told that I could list with the other ones, but it would take me off the list from UCSF. I don't know if it's just related to the Kaiser insurance. So
Kaiser.
Huh. Oh, you don't even have to tell them that you're on, anyhow. I wouldn't necessarily share where, all of the transplant centers that you're exploring.
Well, you're only allowed to stay on one list. Like I can't be on the list at Cedars and UCLA. You've got to pick a center in your OPO geographical area.
Right. Well, your primary, right?
Right. I mean, you know, because they won't multi-list you in the same OPO region. So, yeah, you have to make a decision. And I had to switch transplant centers because I wanted to do a different treatment. I felt like I was breaking up with a boyfriend. I swear to God, I've been for them for so long. It was so hard to change centers when you've been attached to somebody. But it was the right decision for me.
Thank you.
Okay, very good. Do we have any more questions for our guests today? I think we have some comments, but no more questions. I think this was a great discussion, and I want to thank Helen and Glenda for joining us today and sharing the knowledge with us. I especially enjoyed the 5 questions to ask yourself. It's a bit of self-reflection, right? To find out what your goal is that you shared at the very beginning. I really felt like after having a transplant almost 25 years that I feel like I really learned something, a big takeaway. So thank you for that today. Thank you both.
Hey, Chair, I wanted to just mention, and Helen and Glenda, can you talk about the curriculum you created? I mean, this is groundbreaking, guys. This is really important because tell them about what it is to help train staff.
So up until September, there was no single place for an administrator of a dialysis or renal program to reference. So you would have to go and pick, you would know some regulation. And if you were a nurse, you would, had support from your nephrology nurses association. But from a leader point of view, there was no core curriculum. And a core curriculum is just one of those words that means a big fat book. So it's we set out to do this. I'm the editor, and Glenda's the assistant editor, and this tome, or for to reference, it's a shift for the community. The first section is on patient experience and health literacy, and Lori was a part of contributing to that. In between each section, because some of these people aren't clinicians, we included artwork from individuals with kidney disease and children, and there's writings, and so that as you're referencing it keeps you on track for knowing who you're why you work in the billing office, but there's a section on social work and nutrition and finance and where we came from, operations, home dialysis, research, IT. Anyhow, it's big, 800 and some pages.
Yeah.
So individual folks are buying them, and Glenda and I are really hopeful that it's going to make a difference.
Make a difference, right?
Oh wow, that's awesome! Awesome!
All right. Well, I'm going to stop sharing my screen now. This was really an honor, and thanks to all of you who are on. And just say that we send out the very best to you as you move on in your health journey.
Thank you both so much
Thank you.
Thank you.
Thank you.
And a shout out to our corporate mission partners for making this happen.